for this NCD is 146 crores. So I think you can understand what is the focus that we have as a country on NCD prevention. And this has cancer, this has cardiovascular disease, this has diabetes. Now we all know how much is the burden, so I need not tell you about the burden of disease of diabetes. You know much more than what I know. But this is about the allocation of budgets that is happening. Now if you compare that to what is being spent on an average in Arogya Shri, for example, in this state or in the state of Andhra Pradesh. In 2013-14, when there was a combined state of Andhra Pradesh, the total budget spent on PTCA, stenting, was 120 crores. 120 crores. And the number of procedures that were done were around 13,000 procedures. Now the data is lying with Arogya Shri. The data is lying with all the health insurance programs like Ayushman Bharat. Very, very sacredly in the history of the patient, it is written about the comorbidities, whether the patient has diabetes, whether the patient has hypertension, whether the patient is obese, whatever. But none of it is being used for policy or probably for the future course of action for this country. Now, similarly, bypass surgeries budget in 2013-14 was 90 crores. In single state of Andhra Pradesh at that point of time, only on dialysis, stenting and bypass surgeries, the state of Andhra Pradesh spent through Arogya Shri more than 350 crore rupees. And the combined state of Andhra Pradesh in 2013-14 spent through NHM for NCD data capturing and also for prevention and primary care activities only 3 crore rupees. So prevention, we have an investment of 3 crores, and in tertiary care, we have an investment of 350 crores. So this is the kind of investment that is happening into prevention and tertiary. So now how do we reduce the burden on the nation when nothing is going into, a trickle goes into prevention, and then massive Ganga, Brahmaputra together are flowing into tertiary care. So this is what is currently happening in our healthcare system. Now this has already started all over the nation. Ayushman Bharat is now steamrolling across the country. So now the same sort of Arogya Shri program is going to be pushed across the nation. Uttar Pradesh, Bihar, and many other states where previously we didn't have huge tertiary care facilities like in South India. Now small hospitals, 100 bed, 200 bed, 300 bed, especially with the kind of investments that we are seeing, some billions of dollars are going to flow to basically take advantage of whatever is happening in Ayushman Bharat. So when all of this is happening in the tertiary care sector, what is happening is in the primary care sector is very, very important. And how much of it is going into primary care? So the gentleman who actually presented just now from IIM, Bangalore, and many such angel investors, I would request them that if there is a way of finding out how much went into primary care investments and how much went into tertiary care investments, it is also very, very important. I think we require more investments into areas like clinics, like Idea clinics or any other clinics, which would do more of primary care, more home care, more early detection, more of prevention, and more of promotion. And that is key. That is key to reduce the burden on our country and on our nation and the whole world. I will I mean, we all know, we can all tell many stories that have happened at our home, in our family, in friends, and how many people we have been losing because of CKD, then the end-stage renal disease that is picking up so fast. In Arogyasri, for example, when I was there, we were auditing many cases, and one of the cardiologists with whom we were having discussions, who spoke about, how to do a PTCA in a case which has CKD. Should we use Omnipack or VisiPack? That sort of discussions were happening. But the point is, I was speaking to many cardiologists. They say we don't have good data on whether to use Omnipack or VisiPack in a CKD patient. Now, how can we have data? India is the data mine for all the healthcare companies and investment companies across the globe. Now, why does Microsoft want to come to India, or all these investment companies are coming to India? No lunches are free. If Facebook is giving you free of cost, it is using you. If YouTube is giving you something free, it is using you. So if some Microsoft or some other company is coming and helping in data, it is using India's data to build their own health infrastructure, health analytics, health intelligence, and artificial intelligence. I'm not any other company for that matter. So we have data, we have to use it for ourselves, and I think that is very, very important, and that is key. So what I would want to suggest especially is, and I would want to request, now many stalwarts, especially Dr. Rakesh, who has worked with Osmania Medical College for so long, and many professors who are here, I would request you to kindly write to organizations like Ayushman Bharat and Arogyasri and even NHM and NUHM. We would be more than happy. I mean, there needs to be a lot of policy intervention. There needs to be a lot of data sharing, especially for policy correction in our country, for prevention and promotion. For example, now what we are doing at NMC, we have 750 odd medical colleges in India. There was a small committee which was put to understand how the medical colleges are reporting data. We know that a lot of data is fudged. Recently, 3 medical colleges were cancelled in Hyderabad, in and around Hyderabad, private medical colleges this year. Primarily because their OPD is not even 50-100. We know the data is being fudged. So a lot of data has to be live. So there was a study which NMC did. There's a very interesting project, not in USA, not in Canada, not in UK, but country next door, Thailand. So Thailand has a very interesting program called Thailand Hospital Improvement Program, which they run for all the medical colleges, called TIP. They rate every medical college on 108 indicators. And they have these indicators about door-to-table time and all of these. So all these medical colleges are being rated. The medical colleges are giving accreditation, are given ranking based on live data. So something of this sort is being envisaged for all the medical colleges across India. So 750 medical colleges will start to report probably on 30 or 40 indicators that we will start with in next 1 or 2 years. So probably one of the biggest indicators that we would want to have, if such national workshops and conferences can suggest, is the burden of disease of how many diabetics and hypertensives we have in this country when the patients are coming to these medical colleges. So which is very, very important, and the burden is picking up so rapidly. So this is one of the important things that NMC intends to do. So without data, we are just blind and deaf and in the middle of a highway. So with data, we can do many things. And even Sherlock Holmes said it is capital mistake to theorize before we have data. So what my request from this and my takeaway from this conference would be that if Idea Clinics can build a huge data warehouse, and we can take a lot of policy decisions based on whatever data you are collecting and you're presenting, and you'll help the policy makers to work in this country to design best to the best programs, especially bring more investment from government into the primary, promotive, and preventive healthcare. So that is what is key. So thank you very much for giving me this opportunity, and let the investments and all the new ideas and also startups come up more in preventive and promotive and primary care. Thank you very much. Thanks a lot for giving me this opportunity.
We will have a discussion on these two topics, and we request Dr. GVS Murthy that we will have his talk after the inauguration, because we're going to have the inauguration very soon. So before that, I would like to open up for discussion on these two topics. Yeah, please. Can a mic be passed on to the table there? Yeah, to the left, the first table. Yeah.
I'll speak.
Yeah, please.
Thank you. Thank you, Mr. Santosh Kumar, for an excellent analysis of the data and bringing in a lot of inputs to this hall. I have a little different opinion about what you were commenting about investments in primary healthcare. Investments in primary healthcare is a combined investment which we actually look into when we finally deliver it at the level of primary healthcare. It is just not one NCD, or it is just not the NHM or NUHM we look at, but we will also look at a common pathway which actually delivers healthcare at the level of primary health centers. And government has come up with very good initiatives in the last 7 years or 8 years, I would say. There is a lot of good initiative which has come on under the health and wellness centers all across the country, and it is really doing well. I have witnessed in at least 7 or 8 states in India where these centers are doing very well, and a lot of comprehensive healthcare is combined here and is delivered as a final common pathway to the general public. Instead of doctors, they are also now promoting the nurse practitioners to man these healthcare centers, where they look at NCDs, they look at immunization, they look at family welfare, they look at many preventive promotive activities there. So, so what I'm trying to say is, recently we have also witnessed COVID immunization. COVID immunization is the largest primary healthcare activity which India has really come up with. So what I'm trying to say is, over the past 35 years I have been observing the healthcare system, and I'm a part of the government and also a part of the other system also. So encouraging things are really happening, and we started from zero, but at least we are now investing something 146 now in the NCTs, which is not enough, I agree. Data also has been improved. A lot of apps, a lot of programs have been put on apps, a lot of data is coming. We are also supporting Government of India in 10 states in looking at the data, the TB related data, which actually we take out the TB related data and give a meaningful analysis to the states to really respond onto this. So things are going on well. We need to do much better, and initiatives like this also would really add into this. I am very positive.
Can you introduce yourself?
I am Dr. Satish. I work for an organization called Share India.
Share India.
Share India.
Share India.
Yeah. And also I have worked in many various other organizations. I will have a private interactions with you again.
Thank you.
But this was my opinion about this. Let us not get, negative on this, but country is really moving forward, and I have seen a sea change in the last 7-8 years. So I just want to end that in a positive note. Thank you.
Santosh ji is proud to be here because he is one of the two members of NMC from Andhra Pradesh and Telangana. He is one of the members. So he is helping us like in teaching institutions. Whenever we give a phone call, immediately he responds, and is getting a lot of medical colleges this thing upgradation. Santosh ji, I have a small thought process. So, yoga, pranayama, meditation comes under primary care prevention or not?
Absolutely.
So if those things we are promoted to 140 crores population, I think money doesn't need much. Finances, nothing to worry, and that should be the hour of the day for our India. That's my thought process.
Absolutely.
So primary care, we should include yoga, pranayama, meditation, and we should do the data and do the studies.
Thank you so much, Dr. Garu. So I'll quickly summarize. Even today, though 40 to 45% of the out-of-pocket expenditure or healthcare expenditure that is happening in inpatients is happening in private sector. Majority of inpatients are still going to government sector. But in outpatient, even today, you have 70 to 80% of the outpatients still going to private sector. So the public sector investments still need to improve. So that's the whole point. And point well taken, health and wellness center picking up. And I think it's a very good move to Ayushman Bharat that is happening. And hope we see more health and wellness centers which are manned and which are actively capturing data. But there's another problem also that we see. Dell doesn't talk to Deloitte. Deloitte doesn't talk to Microsoft. Microsoft doesn't talk to some other company, ABCD. So every state has its own software company and the data doesn't speak to each other. It's a gazillion number of apps and companies that are working in the healthcare system today and none of them speak to each other and the data is actually very, 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 haphazardly there. So I think there needs to be some coherence in those aspects also. But frankly, what you've said is a point well taken. Health and wellness centers are picking up and there is something positive that is happening in the ecosystem. And on an average, there's a paper that was published a couple of years back. On an average, any outpatient who's a diabetic spends around 9,000 rupees from his pocket per annum, which is 1.3% to 1.2% for a class 1 employee. But for a class 4 employee, it is 27% of his annual income. So this is something which we really need to think through. So how much more of public health expenditure can happen at the primary care is most important. And of course, point well taken. There's an institute called SVASA in Bangalore, which I had visited a couple of years ago. And they have published more than 300 papers. And out of them, almost 50 or 60 are peer-reviewed. And with one of the best universities, the collaborations they have got, especially effect of yoga, pranayam, and all of this on diabetes. And for sure, that's one of the way forwards, and that could be one of the greatest gift India can give to the world. So, thanks a lot.
I want to, in the audience,